Good morning, everybody. Welcome to Sri CPD program today. So let me introduce you from some housekeeping messages. So always keep your mics off and also videos off, and this meeting will be video recorded. So the webinar link will be available from 9 to 9 a.m. showing, and late attendees will not be entertained thereafter. Each attendee should have been attended till the end of the webinar to obtain the certificate for CPD points, and the CPD points are strictly adhered to the NCCPD guidelines. And thank you for the strict adherence of the CPD regulations and your kind compliance. This is to improve and maintain the standards of the CPD programs conducted by Sri. So let me introduce you about asking questions. The questions time is at the end of the webinars, and if you have a question, please type it in the chat function. And please change your chat settings to all panelists and attendees so your questions can be answered. And if we have very specific questions about your situation, please email us on this email. So today's topic is journey through dentistry for medical officers. And let me introduce you our speaker. She is Dr. Sonali Ranathunga, and she's a consultant in restorative dentistry at Colombo South Teaching Hospital. So Dr. Ranathunga is a consultant in restorative dentistry at Colombo South Teaching Hospital, Kalubovila. She holds a Bachelor of Dental Surgery from the University of Peradeniya and MD in Restorative Dentistry from the University of Colombo, and Masters in Endodontics from the Royal College of Surgeons, Edinburgh, and she received her board certification in 2013. Throughout her career, Dr. Ranathunga has served at several prestigious institutions, including Teaching Hospital Kurunegala, the Institute of Oral Health Maharagama, and Lady Rachel Hospital for Children, Colombo. In addition to her clinical expertise, she has made significant contribution to academic and professional development of dentistry in Sri Lanka. She is currently the chairperson of the Board of Study in Dental Surgery at the Postgraduate Institute of Medicine, Colombo, and has been a member of the Specialty Board in Restorative Dentistry for the past 6 years. So Dr. Ranathunga also plays a key role in professional organizations, serving as the treasurer of the Association of Specialists in Restorative Dentistry in Sri Lanka, and as the immediate past president of the College of Dentistry and Stomatology of Sri Lanka. So with her wealth of experience and dedication to the field, we are honored to have Dr. Ranathunga with us today. So our today's topic is journey through dentistry for medical officers. Over to you, madam.
Very good morning to all of you. Thank you very much, Dr. Nirodha, for your introduction. Actually, today my voice is not that good after having a flu for the past few days. And I am trying to do my best during this presentation. Okay, so I chose this topic for this webinar today as a CPD activity for medical officers, because I feel that most of the medical officers need some kind of an update regarding dental issues, maybe their own dental issues, maybe with their family members, or maybe with the patient. So this is an overview of a common dental problems that you may encounter during your life. So let's go to the topic. Yeah. Before we go into the topic properly, I would like to give you a brief introduction about why the smile is important, why teeth are important. So you all know that dentition or the teeth are having different functions in our life. So basically, these functions could be from mastication and mainly mastication or having foods, and also the smile. Smile is very important because it's a facial expression, and you can show your happiness, you can show your friendliness to other people, you can show the pleasure, amusement, and affection by a pleasing smile. So what happens during smile is your corners of the mouth is upward. There is an upward movement of the corners of your mouth, and your eyes are sparkled, and the upper front teeth are visible. Sorry. This upper front teeth, visibility of the upper front teeth is very important during smiling. Depending on the how broad your smile, the visibility of teeth may be different. Sometimes there can be visibility of the teeth even up to the premolar and molar regions. Maybe the lower anterior teeth also visible, depending on the how broad your smile is. Therefore, for maintenance of a proper smile or a pleasing smile, maintenance of proper gum health and proper health of your teeth are very important in our day-to-day life. Therefore, the objectives of this current or today's presentation is to give you an overview of major dental health conditions that could have an impact on individual smile. Also, to give you some basic idea about the causes and its prevention. And I think it's better to give you an idea about the referral of patients with different dental issues. Let's see what are the causes of loss of teeth or a part of a tooth or other oral structures. So if any one of the tooth, especially if the front tooth is lost, your smile is lost. So we'll see what are these causes. Main causes, there are many causes to loss of teeth or part of a tooth or other oral structures. Among them, the dental caries, periodontal disease, traumatic dental injuries, developmental conditions of the mouth, and tooth wear, oral cancer are some of the main reasons why people lose their teeth and the other structures in the oral cavity. Let's see one by one. Dental caries, I hope you all who are in this audience may have some kind of experience at least once in their lifetime regarding dental caries. It's a ubiquitous process. It's a natural process, occurs in the biofilm. What is this biofilm? I know you know about a biofilm. Biofilm is a highly organized structure of bacteria which can be adhered to a surface, and they have the properties of making diseases in human beings. So same as for the biofilm-induced diseases, dental caries also a biofilm-induced problem. What happens in the biofilm? As I mentioned earlier, biofilm contains a lot of bacteria. So day-to-day life, you are taking a lot of food substances, especially the cariogenic foods. What are the cariogenic foods? If that food contains added sugar, that is regarded as a cariogenic food. So this cariogenic food can produce lots of acids with the action of the bacteria in the biofilm. What is this acid? It is the lactic acid. This lactic acid will work on the enamel and make it demineralized. So this demineralization process can be progressed into the dentine. Then there is a cavity formed. You can see, as in these pictures, you can see that how a cavity has been formed in this anterior tooth, and here you can see that cavities are formed in these molars and premolars. So cavitation occurs after some times. It is not an overnight process. So throughout the daily activities, if you are not maintaining the proper plaque control is not maintained properly, this demineralization process will be moved on. So mainly the bacteria, the Streptococcus mutans in the biofilm is the main causative factor causing the initiation of dental caries. So it's a biofilm-induced disease. Let's see what are the signs and symptoms of this dental caries. So you may have, come across these signs and symptoms, maybe in your family member, maybe by your own. So initially, you may have some kind of sensitivity of your teeth or one tooth, maybe having a sensitivity for hot or cold drinks or foods. And later on, you will feel that some kind of a food packing in between teeth or maybe on the tooth, you will feel food packing. And later on, the tooth may become discolored and your sensitivity may be progressed into a spontaneous pain. At that time, what has happened? The progression of the dental caries may be gone into the pulp of the tooth. Pulp is which is inside the tooth, which contains the nerves and the blood vessels of the tooth. So once the carious process entering into the pulp, it can provoke pulpitis symptoms. That's why you get night pain, spontaneous pain. Even during daytime, you can get spontaneous pain. You will feel a cavity on the tooth. Once this demineralization process is progressed further, at one point, the hard tooth structure can be broken and a cavity is formed. At that time, you will recognize that something has happened to my tooth. Therefore, these symptoms and signs are very important to recognize. The early signs are very important to recognize something abnormal or a carious process is ongoing on your tooth. Then, how to prevent this occurrence of dental caries? So, as I mentioned earlier, that demineralization is the cause, or the loss of hard tissue mineral content is the cause for the propagation of the caries process. It's a dynamic process. What does it mean? Dynamic means remineralization and demineralization both occurs at the same time. So if you promote proper favorable atmosphere around the mouth, it promotes the remineralization. As an example, if you maintain, although the carious process has been started on a particular tooth, if you maintain proper plaque control, that is with proper brushing, if you remove the plaque, you remove the cause. There is no or less bacteria to form acids inside the mouth. And also, use of fluoride is very important. So nowadays, people tend to use non-fluoridated toothpaste, which is not advisable, because fluoride containing toothpastes are very important, because this fluoride has a multiple task on improving the susceptibility of not to have the caries inside the mouth, because caries has some kind of a bactericidal, fluoride has a bactericidal action, and also it promotes calcium fluoroapatite formation, which is more harder on the tooth surface, preventing further acid dissolution of the tooth. Therefore, use of a fluoride containing toothpaste is very important. And also dietary modifications are very important, because we have seen a lot of patients with caries activities inside the mouth. Their diet is not good, not healthy, unhealthy diet. Mainly the sugar consumption in these people are very high. If we ask them to write a diet sheet or diet diary for 3 days, we can find a lot of cariogenic food substances they have taken in between meals. Why in between meals? Because most of the time we are taking 3 meals. If you are taking more than 3 meals in between main meals, which can cause the lactic acid formation continuously, and continuously the teeth are bathed in an acid attack, so which is not good. Therefore, in between meals, sugary items taken in between should be avoided as far as possible. So, by doing these things, we can prevent the initiation as well as the propagation of the caries activity inside the mouth. So, therefore, some important facts to summarize: use of a fluoridated toothpaste, twice daily brushing with correct technique. Why twice daily brushing? Because during the night, when you are asleep, there is less salivation, and the bacteria, washing action of the bacteria with the saliva does not function well during night. They will stick onto your teeth, and the further acid attack can be happen, and then teeth are more vulnerable to get caries. Therefore, it's very important to use a good fluoridated toothpaste and brush your teeth in the correct technique. And interdental cleaning. I think you may have heard of this interdental cleaning aids, such as the dental floss, maybe interdental brush, that will help you to remove the plaque or the biofilm in between teeth. So where the brush bristles cannot reach, these areas can be reached with these interdental cleaning aids. And also, as I mentioned earlier, reduce the frequency of sugar intake. It's very important. In between meals, if you want to take anything, healthy snack can be taken which doesn't contain any sugar, such as maybe fruit, maybe some kind of grains, maybe nuts. There are healthy foods in non-karyogenic foods such as cheese, maybe peanuts, yogurt. These things does not have that karyogenic potential. Therefore, it's very important to modify your diet to prevent caries propagation and as well as the initiation of the caries. And professional fluoride therapy. In our clinics, we have fluoride varnishes, fluoride gels, where we use these medications to promote remineralization of the teeth professionally. That for those who are having high caries risk, we advise them to come every 3 months for professional fluoride varnish application, which has shown good results in people with high caries risk activity. So next time when you go to your dental clinic for your checkup, you can request if you are an indicated person for fluoride varnish therapy, you can get it done. So these facts will help you to maintain proper oral hygiene in the future. So whatever the preventive measures we take, there can be still the breakages due to caries activity inside the mouth. You can see in this picture that this is actually one of my patient's photo. She's a medical officer actually. So you can see that the destruction of tooth tissue due to caries processes in different teeth. And because of the dental phobia, this medical officer has not gone for the treatment at the correct time. So this crown has been done few years back, which is very not nice actually. So we can treat these type of patients with proper treatment planning in our restorative dentistry clinics. So root canal treatments, simple restorations, replacement of missing teeth, and finally the replacement of this bad crown, everything can be done and the smile can be regained. So regaining smile is very important because that will improve the confidence in that individual. So I have seen so many patients who have undergone different psychological issues because of their improper smiling, or maybe they are not happy with their smile. So they don't smile at the society. So this, because of maybe a front tooth, broken front tooth, maybe discolored front tooth. I have referred so many people, so many patients to different psychologists, psychiatrists to treat because of the dental issues. They are having some kind of a psychiatric problem. So these can lead to different psychiatric problems if not treated correctly at the correct time. Therefore, prevention is very important. Although the preventive measures are taken, if something has gone wrong, again, there are treatments to make them more towards natural or what was there as initial. So it's very important to know these facts for you and for your patients as well. Let's talk about periodontal disease. So periodontal disease is one of the most common chronic inflammatory disease. So it says more than 90% of the population in the world, maybe 1 or 2 teeth at least, are having some kind of gingival or periodontal problems in most of the teeth. It has a very broad range, maybe starting from simple gingivitis to severe type of a periodontitis. Gingivitis is where inflammation of the gingiva, you can see some kind of a redness or maybe swelling of some part of the gingiva. You can see the plaque accumulation around. So that is reversible. Most of the time it's reversible. When it has been progressed into periodontitis, which is not a reversible condition, but we have to treat this disease. You can see in this picture what much of a periodontal destruction has been occurred in this patient with lots of plaque and calculi around the teeth, migration of teeth, and gingival recession, and a lot of problems due to periodontitis. So same as for the dental caries, periodontal disease also a polymicrobial in origin. There are many types of bacteria inside the mouth. So among them, there are some bacteria such as Porphyromonas gingivalis, Fusobacterium nucleatum, like that way. There are a lot of bacteria which are mainly involved with the initiation or the propagation or maybe destruction of the periodontal tissues. So basically, it is again a dental biofilm-induced disease, but some individuals' immune and inflammatory response contribute to the destruction as well. So inflammatory response itself is destructive to the periodontal tissues. That is, the periodontal ligament, the alveolar bone, gingiva are destroyed by this inflammatory response as well. Therefore, again, the prevention is very important. There are some risk factors identified. The main two risk factors are smoking and the diabetes. Why smoking? Smoking has a vast number of effects on the periodontal tissues. The important finding in smokers is you don't see any inflammatory response on the gingiva in smokers. The destruction occurs inside the gingiva or inside the periodontium without showing any inflammatory signs outside the mouth on the gingiva. So they don't usually show bleeding signs because the gingiva is in a different color, maybe whitish in color. So you don't see any inflammatory signs. So, but they are more prone to get, smokers are 3-4 times more prone to get periodontal disease than non-smokers. Same as diabetes. Diabetes, I think you have heard of the bidirectional effects of diabetic on periodontal disease. That is, if somebody is having periodontitis and diabetes both, control of both diseases need the control of both disease. That to control the periodontitis, we should control the diabetes. If to control the diabetes, periodontal disease also should be controlled. Therefore, both diseases should be controlled together to gain proper results. So if you have come across any patients with diabetes, with periodontal disease, it's always better to refer for a dental cleaning and maintenance of proper oral hygiene, because this periodontitis is not just cleaning of your teeth. It is more beyond that. And it needs proper referral and proper treatment for these patients, especially with diabetes. So let's see what are features of periodontal disease. So initially, as I mentioned, there will be redness and bleeding during brushing. That is the earliest sign. So sometimes you also may have heard of patients are telling that there is bleeding from the teeth or the gums when brushing. Then if you are not taken that into consideration, then it can be progress into spontaneous bleeding. And then the gingiva can be swollen, reddish, and there can be gingival recession. At that time, the gingivitis has progressed into the periodontitis, and the mobility of teeth can be there. There can be sensitivity of teeth and also halitosis. There can be patients may have complained to you regarding a bad breath. So that can be a feature of periodontal disease. And finally, because of the mobility, the teeth start to move apart. So sometimes they can end up with procline teeth. Sometimes the spaces appear in between the teeth. Therefore, this periodontal disease has a lot of features, but initial features anybody can identify. As medical officers, you can identify these features and necessary referral can be done. So I have seen many patients that this sometimes because of the bleeding, sometimes the doctors, even the dental surgeons, they just give some antibiotic and just keep the patient like that. But it is not the treatment of choice. No antibiotic can cure because this is a local problem due to plaque. So plaque removal and proper maintenance of the oral hygiene is the treatment of choice. Therefore, by giving antibiotics is not recommended. So it can improve the condition for a few days, but as the cause is still there, it can reappear. Therefore, it's always, if there is a patient like this, give them oral hygiene, proper oral hygiene instructions and refer them. So that is very important for the prevention of propagation of disease into an advanced stage. So this is again another patient. You can see that in this picture that how much of destruction of the periodontal tissues has been occurs. All these teeth were grade 1 mobile, grade 2 mobile, and you can see the spacing of the teeth in between. And after treatment, after initial non-surgical periodontal therapy, once the patient is maintaining proper oral hygiene with good compliance, we were able to do the surgical periodontal management. That is, being the bone, the alveolar bone is destroyed in most of these teeth. Bone graft can be done with raising of the gingival flap, and the lost bone can be regained with bone grafting. Nowadays, it's with mainly the platelet-rich plasma we use to induce new bone formation in these types of patients. And once the disease is stabilized, the lost smile can be regained with orthodontic treatment with proper alignment of the teeth. Now the periodontium is stable to move the teeth. Once it is stabilized only, we can go for all these aesthetic procedures. This picture actually taken after orthodontic treatment. You can see the improvement from here to here. So these things can be done provided the patient has a good compliance and lifetime maintenance. Patient should have the ability to maintain good oral hygiene throughout after the proper initial management. Okay, then let's talk about the dental trauma a little bit. You all know that dental trauma is very prevalent these days due to lots of issues, especially the road traffic accidents and sports injuries, assaults. In Kalaboila, lots of patients come with assaults. So not only in Kalaboila Teaching Hospital, everywhere I think it's the same. Even in Kurunagala, when I was working there, the assaults are very common, and road traffic accidents, especially the motorbikes and these three-wheel accidents. And also workplace-based accidents are very common. So these things can lead to traumatic dental injuries of the teeth. I know most of your medical officers are having problems related to these traumatic dental injuries. Sometimes they are having their family members, having maybe children, so having the different types of traumatic dental injuries. So these types of injuries can occur at any age of any individual, but it's more common in young age, especially in immature children when they try to stand up, when they try to walk and climb, they can have some kind of injuries to their teeth, especially in deciduous dentition. So crown fractures can happen, luxation injuries. These are the commonest types. There can be multiple teeth injured at the same time, or maybe one tooth injured. Among all the types, there are different types of injuries which can occur to the teeth. But among them, avulsion is one of the most serious dental injury. What do you mean by avulsion? Avulsion is total displacement of the tooth from its socket. So basically, the tooth is not there on the socket. It has come out due to injury. It's very important, you have to know that correct emergency management at the time of injury will help to improve the prognosis of that affected injured tooth. So that is very important, because if somebody encountered avulsion injury, if the patient is in good condition, it's always better, if the patient is conscious, better to find the tooth and hold the tooth from the crown, not from the root, because root contains a lot of viable cells, periodontal cells. These cells can be damaged if we try to hold the tooth from the root. Therefore, you have to hold the tooth from the crown and slow running tap water to clean and then put it into the socket. That is the first aid measure that anybody could do during an avulsion injury. So if anybody is reluctant to do that, at least after washing the tooth, put it into a good storage media, maybe milk, maybe coconut water, maybe king coconut water, like that, to at least saline. So these measures will help to maintain the vitality of these very viable or maybe very sensitive periodontal ligament cells to regain the tooth attachment to the alveolar bone. So it's very important to do that. Therefore, it says if we can replant the tooth within the first 20 minutes, the success of getting the tooth attached to the bone is high. Therefore, that we have to keep that in mind. If you encounter any patient, maybe in accident and emergency department, maybe in the road, maybe in your own private practice, wherever, if you encounter patient, you can do that by your own. You can wash the tooth, hold the tooth from the crown as shown in this picture. You can see that here the tooth is held with the crown of the tooth, and then wash it and then put it into the patient's own socket. And you can then you can refer the patient to a dental clinic for a splint. Splinting is done to stabilize the tooth in the same position. We leave the splint for 2 weeks until the tooth is attached to the bone again. So this patient has brought this tooth in the saline water. The best medium would be milk. So after the avulsion injury, damage to the dental pulp, as I mentioned earlier, the pulp contains nerves. So during the traumatic incident, if a fracture of the tooth occurs from the middle of the tooth and exposing the pulp, there is a possibility of pulp getting inflamed and infected. Therefore, as soon as possible, this pulp should be treated with pulp therapy. And if you find that piece of the tooth broken, that part can be reattached to the tooth. It can be reattached after preserving the pulp. So necessary referral of these patients as soon as possible, if you see these types of patients, is very important. You can easily identify the pulp by this redness of the pulp on the middle of the tooth. So if the part of the tooth is broken, we can see that pulp exposed or not. If it is pulp involved, it needs urgent referral for proper management. Some important facts for you. So for any kind of dental trauma, seek the treatment as soon as possible, because any trauma type needs urgent care to prevent further complications. Most of these complications, most of the after effects may be related to improper attendance to the, or maybe delayed attendance to the clinics. And permanent avulsed teeth can be replanted. Most of the time, if deciduous tooth is avulsed, we don't try to replant that deciduous tooth, only the permanent teeth. If pulp is involved, pulp preservation is important. Otherwise, tooth can undergo non-vitality very soon. Splinting of teeth is very important to promote healing. Same as if maybe your leg, maybe your arm is injured and broken, we stabilize that with a splint. That is to promote healing. So same as that, if the tooth become mobile or luxated or maybe avulsed, need splinting of the tooth. And also it needs long-term review. Most of these injuries can have complications later on in their life, especially in small children. Therefore, it is very important it's mandatory to long-term review of the patient. So we are having a lot of patients reviewing in our clinics. Some patients we review up to 5 years, maybe some patients up to 2 years. But after that also lifetime reviewing is very important to identify the problems associated in the future. Let's talk a little bit about the developmental defects. Developmental defects in the orofacial region is very common. I think you know the cleft lip and palate. It's the most commonest, and maybe everybody have seen these patients with cleft lip and palate. So they are having a lot of oral issues, maybe missing teeth, abnormal teeth, clefts, remaining clefts, but most of these hospitals are having cleft lip and palate joint clinics with it's a multidisciplinary type of a clinic where restorative consultants, OMF surgeons, pediatricians, plastic surgeons, everybody will look at to these patients to treat them properly. Apart from cleft lip and palate, there are a lot of other developmental disorders which can have deviations from the normal. Maybe color of the teeth are very abnormal, highly abnormal, as seen in this picture. This is a child with aminogenesis imperfecta. You can see that the teeth are very dark in color. So these patients, they are having multitude of various types of psychological issues, especially they don't like to go to school sometimes because of this appearance of teeth. They are socially deprived. So therefore, these children need treatment as soon as possible. And also, this is a child with ectodermal dysplasia. You know, this ectodermal dysplasia having multiple dental issues, especially the hypodontia, maybe the conical teeth. Hypodontia is less number of teeth. You can see in this child, less number of teeth, maybe 5, 6 teeth to the whole mouth. So they need replacement. Developmentally, they don't have teeth. So they need replacement for their proper function. Therefore, these kind of developmental defects, you may encounter patients with children with these types of disease, maybe adults, because they don't know that the treatments are available. So you can refer or you can direct them to the necessary clinics for proper treatments at the correct age. Again, cleft lip and palate. Yeah, this is dental fluorosis. Dental fluorosis is a very common developmental disorder in our country. There are fluorosis endemic areas such as Anuradhapura, Polonnaruwa, maybe towards Monragala, Amblipitia. Those are fluoride endemic areas where the water contains higher amount of fluoride, which has predisposed the teeth to have this kind of a whitish to brownish discoloration. So this child also having these severe types of dental fluorosis, you can see the brownish discoloration on the teeth, which has some kind of profound aesthetic problem in this patient. So with a very less invasive technique, we called it enamel microabrasion. We can remove this fluorotic brownish patch. Further enhancement of the aesthetics can be done later. So it's very important to remove this patch to improve their social well-being and their social life. And once they are mature enough, further improvements of the aesthetics can be done. So all these problems are having treatment. So that's the importance that you have to know that these problems can be treated. Then one of the most important thing nowadays is the tooth wear. Tooth wear is very common in generally now in the population. That is mainly due to people retaining their teeth, natural teeth, into the old age. Even after 60s, 70s, most of the time, most of the people are having full dentition. That's a good sign. Unlike in the past, they are more prone to get their teeth extracted and then go in for the dentures, or maybe without dentures for the rest of the life. But whereas now, because of they are retaining their natural teeth in the dentition inside the mouth, they are having tooth wear, because wear and tear during your lifetime cannot be prevented. But if the tooth wear can become pathological due to various reasons. This is the patient with the first one, the picture. Patient with, if I can remember, he's a bipolar disorder, with the bipolar disorder. So with frequent clenching of teeth, it has been ended up like this. So at that time, when we get this patient's referral, it's too advanced. If you can identify these types of patients early in your clinics, it's very important to refer them to our clinics. Then it's important because we can intervene at that time. You can see the amount of tooth tissue remaining in the upper arch, very limited. So amount of treatment we can perform on these patients also very limited, especially in government sector with less facilities. But if we can prevent that, it will help us to maintain their teeth in the original position. In this patient also, you can see how much, again, a patient with psychological disorder. So amount of tooth loss, only the lower incisors are remaining. The upper incisors are worn down to the gingival margin level. So this patient is having acid erosion. She is a daily consumer of acidic drink, every day consuming of lime juice and sipping of lime juice, taking lime juice long hours, has caused the erosion of the teeth, especially the upper anterior teeth, to this level. So this can be prevented. So this acid erosion can be extrinsic, like from the acidic foods or drinks, as well as it can be intrinsic as well. So intrinsic, due to gastric regurgitation, due to gastric acids, the upper teeth, especially the inside from the palatal surfaces, this type of wear and tear can be seen in acid erosion patients. So if you have seen those patients, you can get you can do proper referral and get a proper idea about their oral status. Therefore, this tooth wear, we can manage this tooth wear at the correct time. Even at this level, become very advanced type of tooth wear, we can still manage, but it's always better to prevent at an early age. There are a lot of preventive regimes available for tooth wear. So prevention is always much, much better than taking them a long journey of treatment. Okay, so let's talk a little bit about oral cancer. Oral cancer is one of the most commonest cancers in Sri Lanka, especially in males. Predominantly, it's prevalent in males. But nowadays, it's becoming more in females as well. So there are risk factors which are involved with oral cancers. Most common risk factors, I hope you know about this: tobacco and alcohol. Tobacco can be either chewing with betel or can be smoking cigarettes. So both these have synergistic activity as well. If a person consume tobacco and alcohol both together, they are having a higher risk than individual consumption alone, or not consuming. Somebody is not consuming, that person is having less risk. Therefore, habit-related oral cancers are habit-related, and also it can be a preventable disease as well. Apart from this tobacco chewing and smoking and alcohol consumption, diet and nutrition also have some kind of a role in preventing oral cancers. And also viruses, especially human papilloma virus, have some association with causation of oral cancers. And radiation, especially UV light, the lip cancers are more common with this radiation type of injuries. Among all these oral cancers, more than 90% is squamous cell carcinoma. So, and these carcinomas are mainly related to these risk factors and consumption of tobacco and alcohol. Therefore, the suspicious patients can be screened, and early detection of these oral cancers are very important. Most of the time, what we heard in the oral and maxillofacial units from the oncology units, that the higher grade cancers are recognized, not at the early stage. That is the pathetic situation. So as preventive measures, if we can implement a good screening of our all patients, so these cancers can be rectified, or this can be detected at the early stage than later. So this is a patient with oral cancer or carcinoma. You can see the upper palate, the anterior palate region. It has a very huge lesion. So it has been resected, and you can see how destructive the resection, causing the exposure of the nasal cavity also. So there is, once this palate part is removed or resected, there is always a communication between the oral, antral, nasal cavities. So patient can't have a proper normal life. So regurgitation of water, foods, and seeping out of liquids is very common in these patients. So rehabilitation of these patients are done in restorative dentistry clinics by giving them a prosthesis like this. But it's very difficult to gain the normal level with this type of prosthesis. We always try to give our best to this type of patients. You can see that giving a prosthesis with the help of remaining teeth will help them to maintain proper functions and aesthetics as far as possible. So these types of rehabilitations can be done in the restorative dentistry clinics, but preoperative, the patient should be jointly managed with both surgical team and with the rehabilitative team. Again, another patient, you can see that after resection of the anterior part of the maxilla, some time back, the wound is now stabilized and there is no recurrence. Then we have planned to give a definitive prosthesis with a metal plate. So this is a teacher. So after giving that, she was able to go back to her work, that again teaching career could be started. So rehabilitation of these kind of patients are very important to give them a normal life as far as possible, as well as to give them a better social life. Okay, so we talk about altogether now the different causes of loss of teeth and how to prevent those and what should be done if something happens. So I think it's better to give you some overview about missing teeth and their replacement, because we are seeing a lot of medical officers in our clinics requesting different prostheses, different types of replacement of missing teeth for them or maybe their family members. So there are ways of replacing missing teeth. So dentures can be done. Dentures is a removable device. It can be made for a single tooth. Maybe the full arch can be replaced with dentures. It's a removable device. And it is less cost effective, and most of the clinics it can be done. And bridges. Bridges is a type of a fixed prosthesis. Unlike those days, we don't cut teeth to give bridges now. There are less invasive bridges techniques which don't, without destroying the adjacent teeth, those bridges can be done. But currently, the practice or the gold standard of replacing missing teeth are the implant retained crowns or bridges. So implants are the current practice. Most of the time you all come and ask about implants and how to replace the teeth with implants. So I thought of giving a brief idea about implants. So this is a patient after missing this central incisor, left central incisor due to an road traffic accident. So he couldn't find the tooth and the tooth is not there. So we decided to give him an implant retained crown. You can see the surgical placement of the implant. It's a minor surgical procedure, the placement of the implant. Implant is a titanium-based metal part which we embedded into the bone, and then we allow osseointegration to happen. That implant should be fixed to the bone. We give 3-4 months, and then implant is exposed and the crown is done on top of the implant. So this will act as a single independent tooth, same as your natural tooth, but no proprioception, no sensation from as your natural teeth. This is a single tooth implant. So it can be again done for patients like this. This is again missing this lateral incisor. It can be replaced with this type of implant retained prosthesis. This patient has lost these 2 central incisors. So 2 implants can be used to replace these 2 incisors. This is the prosthetic abutment where the implant crown come and hold here. We can hold the crown here with this use of prosthetic abutment. And this is again another patient with developmentally missing lateral incisor and canine on both sides. We rehabilitated this patient using 2 implants on either sides. So these treatments can be done. So basically, we can have single implant and single crown. If multiple teeth are missing, multiple implants and single crowns on each implant. And in this patient, he has lost all 4 upper incisors. So 2 implants has been used to replace all 4 incisors as an implant supported bridge. So implant planning, and depending on the where we want to replace the tooth, these types of planning and treatment can be done. So let's talk about a little bit about other common problems in the oral cavity. I think this is relevant to you. Angular cheilitis. You may have seen a lot of patients with angular cheilitis. Angular cheilitis is a common inflammatory condition which can affect the corners of the mouth or the oral commissures. And we have seen this in old age, especially people who do not have teeth, or maybe they are not using dentures. Even they are using dentures, if the dentures are very long-term used one, where they have become very poor in quality. So why with age, with loss of teeth, what happens is the lower facial height is being reduced. There will be an overclose of the mouth. So the face, the muscles, everything is overclosed. Therefore, the salivary pooling can occur, and there can be angular cheilitis occurring at the corners of the mouth. And there can be deep skin folds. Ulceration of these skin folds can be happen. Sometimes they can be infected with bacteria and fungi. Maybe they are normal flora inside the oral cavity, but they can be infected. And also there can be a variety of nutritional deficiencies associated with angular cheilitis. Systemic maybe problems, maybe drug-related factors, or combination of all. So all these factors can lead to angular cheilitis, especially in old age. So you can see this is again one of my patients. You can see that this is a 60, I can remember 68 or 70-year-old female. So she has worn a set of dentures for last 40 years. So that set of dentures was having very poor quality and not in proper way. So as it is inefficient, the dentures, she has used her lower jaw forward to have a proper meal. So this is a habitual posturing of the mandible. So this, you can see the lower face height is reduced. So this is after giving her proper new set of dentures. You can see how much of improvement of the face can be happen with the proper proper establishment of the face height. This much of face height has been increased up to this much. You can see from this nose to chin, the distance is increased with giving proper height of the dentures. So a patient like this is more prone to get here. You can see the fold of the skin here, more prone to get angular cheilitis. Once you establish the proper facial height, these problems can be prevented. So in old age, giving dentures to these patients are very important to maintain their face aesthetics as well as to maintain proper function of their mouth. The dry mouth, I think this would be the last slide. A dry mouth is a common complaint of patients. Inadequate water intake is the most common cause for the dry mouth. If you ask from these patients, they may say that drinking of water is not adequate. And also, there can be some associated factors, maybe medications. Some may have taken, some may are taking a lot of medicines at the same time. So they have some kind of effects on the salivary glands, causing dry mouth. And some may have undergone chemotherapy because the cancers are so common, and radiotherapy, especially orofacial region, thyroid cancers. Radiation can cause destruction of the salivary glands, and also the production of the saliva can be less. So important thing is these dry mouth patients can have lot of caries in their mouth. Rampant caries, we call them rampant caries, especially at the cervical margin or the root of the tooth, having lots of caries. And also, if there are denture wearers, their dentures won't retain if there is no moisture. And there can be lesions or the mucosal lesions and infections of the oral cavity or the oral mucosa. Mucositis can happen, redness can be there. So it's always, therefore, better to identify this dry mouth and give precautions or preventive measures to prevent further complications. So frequent sipping of water, you can advise on frequent sipping, and also if it is not improved properly, we have to find out the real cause of the dry mouth. I think that is the end of my presentation today. I think if you have any questions, I'm very happy to answer the questions and give you more important facts.
Thank you so much, madam, for the excellent presentation. And we have a few questions, like not few, the long list of questions in the chat box. So I start from the first one. What are the causes for painful gum in whom teeth are free of caries and free of comorbidities like diabetes?
Yeah, pain of the gum.
Yeah.
Yeah, that is basically the pain. Usually the gum diseases does not cause severe type of pain unless there is some kind of a underlying factor. But the gingivitis can have some kind of a sensitivity, maybe initially, but later on, if not treated properly, there can be pain. And also maybe underlying systemic problems, maybe sometimes burning sensation. Also, some patients can mention it as pain, burning sensation of the mouth, maybe due to dry mouth, maybe due to other polypharmacy. Those are the causes. But usually, gingivitis alone is not giving that much of pain of the gum.
Thank you, madam. So is there a way to grow back the gums which was regressed by previous periodontitis?
There is no regrowth of the gum. What we can do is, if there is an indication, we do the gingival grafting procedures, especially if aesthetically important. Say, for an example, if the upper central incisor has a gum recession or gingival recession due to previous disease. So if the disease is stabilized, if now there is no periodontitis, we can think of mucogingival procedures, that is grafting, gingival grafting, and making the gum try to make the gum to the a normal level. But usual natural regrowth won't occur.
Thank you, Madam. So regarding preservation media of Eval's tooth, is it fresh milk, cold milk, or hot milk?
Really, should not be hot milk. It can be cold or maybe fresh milk. Whatever the milk is available, you can use. Not
So
hot.
next one is, yeah, one of the friends had dental trauma and not evolved, no, not evolved, I think, but discoloration happened. To prevent that, what we can do?
After dental trauma, discoloration.
Yes, madam.
Yes, discoloration is a common thing after dental trauma. Most of the time we see with concussion injuries. That is, after trauma, you don't see just after the trauma, no mobility, nothing, no pain, nothing. But after some time, maybe 2-3 years later, patient come with the discoloration. That discoloration we can't prevent because we couldn't identify it at the beginning that trauma has been happened to the tooth, and especially the calcification. What happens during these traumatic incidences, because it's a chronic inflammation, tooth itself starts calcifying inside the pulp chamber. This calcification end up with a yellowish type of a discoloration, so which cannot be prevented by any, no, there is no treatment to prevent the discoloration. Only thing we can treat the discoloration. But if the discoloration is becoming more, then you can seek the treatment. And at that time, if the tooth become non-vital, root canal treatment and maybe bleaching technique can make the tooth more, pleasing to the normal color. But most of the time, discoloration cannot be prevented.
And the next one is, madam, Eval's tooth, does it need urgent referral, or within how much duration need referral?
As soon as possible. That's why I told you, if you can place the tooth into the socket, that is the most important thing. Then you can ask the patient or refer the patient to the dental clinic for the splinting. So this replacement or replantation of the tooth to the socket can be done by anybody. Even a normal individual, normal layperson can do that by holding it from the crown and clean the root if there is mud or sand or whatever. Clean the root and then put it into the socket. That is the first aid. Then you can send the patient to the clinic, to make the splint.
Thank you, madam. So when one lower jaw molar tooth removed, the same upper tooth get dragged and lengthened with pain. So what is the treatment?
Upper tooth, usually what happens if one tooth is extracted, what happens is the opposing tooth moves down to that space because there is no opposing force from the opposite side. Therefore, the tooth moves down and the adjacent two teeth move to that space. Therefore, there can be a lot of problems. We have seen food packing, those kind of problems can be there. To prevent this, one is before you, nowadays we practice this preventive things because before extracting, it is better to try to at least preserve the tooth as far as possible before extracting. If it is extracted already, then it is better to get an advice regarding the replacement of that missing tooth in order to prevent the complications occurring. That is, over-eruption of the opposing tooth, migration or tilting of the adjacent teeth. All these things can be prevented with proper consultation and getting an advice. Yes.
Next one, madam. What are the causes for pain in a tooth while chewing, and what are the treatments?
Causes for?
Pain in a tooth while chewing.
When masticating.
Yeah.
Okay. So if there is an underlying cavity inside the tooth, which can cause pain on biting, okay? And also if there is a crack, there may be the tooth is very good, but cracks are very, very common nowadays. We have seen so many good teeth undergoing cracks, and a patient come with pain during biting. That is the only sign we can, sign and symptom we can look into. Even radiographs doesn't show. So that is again one thing. And sometimes the advanced periodontal disease also can have pain during biting. Those are the causes, main causes. If there is a periapical infection, it can also cause pain during biting.
Yeah, so next one is in fluoride endemic areas, is it needed to use fluoridated toothpaste?
Yes, yes. So because fluoride in endemic areas, they have high fluoride content in water, it is a systemic effect. Whereas in fluoridated toothpaste, what we try to achieve is a local effect. Because local environment, that is the inside the oral cavity, you are giving from outside, you are giving high fluoride amount or fluoride ions to promote remineralization of the tooth. That fluoride inside the water affects during the developmental stage of the tooth. That is when the tooth is developing inside the bone, that fluoride containing water has given more fluoride ions and it has caused some kind of a discoloration and some fluoroapatite formation in the tooth. So two different actions. So even in endemic areas, you need fluoridated toothpaste.
Next one, madam, please tell about tooth whitening treatments.
Whitening, yes. So whitening is very, it's very common and most of the time it's less invasive technique to give a brighter smile. So whitening, there are two types. One is vital bleaching. That is, if you have discolored teeth and if you want to get overall discoloration improvement, then you can go for vital bleaching. That is, the teeth which are visible during smile, you can get bleached. But it is not that needed in our country, like because almost all of us having teeth more, not a very bright teeth. We are having a teeth color which is more similar or which is compatible to our skin color. So if we are having very brighter teeth, it may not be compatible with our skin color. It is different. Then vital bleaching can be done, especially if you have a special occasion. Maybe you are going for some kind of a special function, or maybe you are having a wedding. So in those occasions, you can have vital bleaching and improve the shade of your teeth. But you have to keep that in mind. It's a reversible procedure. With time, again, the discoloration can be appeared.
Thank you, madam.
Uh,
So,
yeah.
next one is,
yeah.
what are the systemic complications of having decayed teeth and what are the complications in pregnancy?
What are the systemic conditions?
Complications of having decayed teeth.
Yes. So by having caries teeth, if the caries can progress into the pulp and the periapical region, the infections can be spread to the other areas as well. The tissue spaces can be infected, and then you can have the abscesses, you can have some kind of a fever, malaise symptoms, those kind of symptoms can be there. And even in pregnancy, it's not good to have, it can be very uncomfortable if you have pain. Therefore, always it's better to treat your teeth or your patients before being pregnant, or maybe even during the pregnancy. Most of these treatments can be done. Yeah.
Thank you, madam. So, are there dental emergencies which we need to refer even in the middle of the night?
Yes, as an example, the avulsion injury, it should be, and then if the patient is having a severe type of a pain should be managed. If it is due to dental caries propagation into the pulpitis symptoms during night, even sometimes the antibiotics, painkillers may not be giving good effectiveness. So pulpectomy or the treatment, root canal treatment may be the treatment of choice. Yes.
Thank you, madam. So, next one is, how long can we keep titanium implants? Is it lifelong?
Yes. Yes, it's lifelong. The implant can be there, but the problem is the suprastructure, the crown, there can be breakages. You may need to replace the crown after some years. Those problems are there, but titanium implant is there inside the bone, unless we're due to some other reason, if we remove that.
Next, madam, at what age malocclusion of the teeth should be corrected, and are all be correctable?
Yes, most of the malocclusions are correctable. There are different ages. Say, for an example, if usually any child should have their permanent set of dentition completed by the age of 12. So most of these malocclusion starts at the age of 12, correction. But there are some situations need urgent intervention. As an example, some children, they have we called it crossbite, that upper teeth are backward, lower teeth are in front. So these kind of treatment. Then sometimes the severe protrusion of teeth, because these children or these adults are more prone to get fractures of the teeth. Therefore, these are regarded as should be corrected early. So depending on the problem, the age can be determined. There is no age limitation, even at the age of 60, even at the age of 70. If you want to correct your malocclusion, you can get it done.
Thank you, madam. So what can be done for white patches on teeth?
White patches, the reason we have to find, and then it can be, if there is a aesthetic concern, can be corrected with the color of the other areas of the teeth. That patch can be camouflage. Yes.
One few last questions, madam. After tooth extraction, especially molar tooth, if there's a slight permanent paresthesia of tongue on the same side, is there a possible to treat it?
Usually this occurs with the third molar surgical removal, paresthesia, because there is a very close relationship of the lingual nerve and the inferior dental nerve to the lower 8, especially the lower third molar. These are usually these types of paresthesia, they are not permanent, they are transient. So with time, sometimes maybe 1 week, 2 weeks, 3 weeks, maybe a few months later, most of the time will become normal.
Thank you, madam. So can dental implantation be done even after some gum recession?
Yes, depending on the site, we have to assess properly. Not only the gum, even the bone recession. Bone is not there sometimes. With bone grafting, soft tissue grafting, there are procedures, augmentation procedures. If there is a real need, we can consider those things as well. Yes.
Next one is, what are the limitations of implantation?
Limitations. There are a lot of limitations, especially smokers. Smokers are not good candidates for implants because the osseointegration, those things won't be happen. And the survival of implants may be poor, and uncontrolled diabetes and immunosuppression, maybe having other immune compromised diseases. Those are the real contraindications for implant placement. And if especially the age, young people, we don't do implants. Older the better, because there can be changes with development. So age below 20, no implants can be done. Yes.
Thank you so much, madam. So that will be the end of the questions for today.
Yeah, a lot of questions, no? Yeah.
Yes, madam. So our sincere thanks go to Dr. Sonali Ranathunga, consultant in restorative dentistry in Colombo South Teaching Hospital, Kalubovila, and for her excellent presentation and the precious time and answering the whole lot of questions. So thank you everyone for the participation, and we have posted the link in the chat box, and kindly give your feedback and also answer the post-assessment questions so that you can receive your e-certificate for participation. So thank you so much, madam, again, for your time and your precious.
And thank you very much.
And
thank you very much for giving this opportunity. Yeah. Yes.
And thank you everyone. So kindly give your feedback and answer the post-assessment questions. So thank you and have a nice day.
Have a nice day. Thank you.